So I'd like to just end up with some novel approaches to pancreatic cancer therapy and think about how do we sort of point to the future for chemotherapy for pancreatic cancer. So the first thing is sort of going back to what I talked about earlier, is now be developing treatment to target the stroma in these patients. And so this was looking at spark expression in resected tumors. Spark is a protein that's expressed in the stroma. And so what they showed here is that patients who had spark expression, whether it's in the stroma alone or in the tumor plus the stroma, those patients had a significantly worse outcome than those patients who did not have stromal involvement with spark expression. So why is this important? Initially, there was a thought that potentially spark may result in improving the uptake of chemotherapy within the tumor and therefore get higher levels of chemotherapy within the tumor. And this was based upon the fact that spark binds albumin, and Abraxane, which is currently being studied for this disease, is albumin conjugated to paclitaxel. And so this was evaluated in the phase 1/2 study, and the primary toxicity that was seen was fatigue, neuropathy, neutropenia, as well as low platelet counts. However, the combination therapy with gemcitabine and Abraxane in a phase 2 setting, so this is a single-arm study, was 12 months. So close or maybe even better than what we see with FOLFIRINOX. So promising that we may have a therapy that may be less toxic than FOLFIRINOX for this patient population. Now, if you look at the stroma and you ask the question, what happens to the stroma in tumors that are exposed to gemcitabine and or Abraxane, here's what we see. And so in the controls, we see there's a large amount of stroma. With paclitaxel, there is some denudement of the stroma or less stroma with Abraxane by itself versus what we see with gemcitabine. But the interesting thing is when you combine these two, you see a marked decrease in the stroma. And this is associated with increased gemcitabine in these tumors and response, so shrinking of these tumors. There's now some evidence that what happens when you combine these two drugs together is that you alter the expression of enzymes within the cell, in particular cytidine deaminase, which regulates the amount of gemcitabine that's within a cancer cell. And this is just showing that when you treat with Abraxane plus gemcitabine versus gemcitabine, there's an increase in the amount of gemcitabine in the tumors, and that the tumors respond with the addition of gemcitabine plus Abraxane versus either alone. So there's an additive response with the combination therapy. Now, this is all phase 1/2 data. Some of this stuff I just showed you with actually the stroma denudement, and these depicted here on the slide are actually preclinical models of pancreatic cancer and how the drugs may work in combination. So currently there's an ongoing phase 3 study in which patients are receiving gemcitabine versus gemcitabine plus Abraxane. It's now close to accrual, and so hopefully the results of this study will be available to us in a short time frame, and if positive, then they may impact the approach to treating patients with pancreatic cancer. So it may be that if the survival benefit associated with the combination is similar to that what we saw with FOLFIRINOX, and it's less toxic, you could then sort of begin to divide patients up based upon their performance status or how they're doing physically and give them appropriate therapy, but yet potentially have the same outcome. So this is a very interesting time for pancreatic cancer therapy, and our field is awaiting these results of the phase 3 study eagerly. So future therapeutic directions include molecular patient stratification, molecular targeted therapies, genetic-based therapies, as well as targeting alternative components within the tumor. So we talked a little bit about stromal components. The extracellular matrix is currently being targeted by looking at enzymes that may break down the extracellular matrix. The cancer stem cells, these are being targeted by using drugs that specifically inhibit molecular pathways that are important for those pancreatic cancer stem cells to survive as well as to grow. And then there's a body of evidence that using vaccines to modulate the immune response associated with pancreatic cancer can impact the outcomes of these patients. So with that, I'd like to thank you for listening to this. I hope this was helpful as you move forward with your pancreas cancer therapy.
Thanks for listening. If you like and learn from our GRACEcast, you can subscribe on iTunes by just searching for the term Cancer Grace, find podcasts in the subject you want, pick a format of audio or video, and then just click subscribe. It's that easy. And for those of you who don't want to miss any of our programs, there's even a feed for all subjects. You can also find us on YouTube at Grace for Cancer Info, and that's the number 4 in one word, Grace for Cancer Info. Finally, if you haven't been there yet, please check out our GRACE website at www.cancergrace.org. And don't forget that donate button in the upper right. Our content, which helps tens of thousands of cancer patients around the world every month, is made possible by your support.